Okay, guys, good afternoon. I have discussion B for you. Now, this one, we are talking about loneliness during transition of care. Like a person entering a nursing home or, those kind of things. So, we're going to discuss that for B. So, please join me for today's discussion B. Okay, here we go. The first night home. When the transport van pulls away, Mrs. Alvarez stood in the doorway of her small yellow house, clutching the discharge folder like it might blow away. The driver had carried her walker up the steps, set it beside her, had offered a polite nod before leaving. The house was quiet in the way only a house that had been waiting too long can be. Inside, everything was exactly where she had left it before the fall. Her knitting basket beside the recliner, the half-finished puzzle on the card table, the framed photo of her late husband smiling from the mantel. But the rooms felt different now, as if they were holding their breath. The hospital had been loud, bright, full of people who came and went. She had not liked it, but she had not been alone. Someone always entered, checking vitals, adjusting pillows, asking questions. Here, the silence pressed against her ribs. She lowered herself into the recliner and unfolded the discharge instructions. Follow up with primary care within 7 days. Call home health if symptoms worsen. Avoid stairs. She read the words, but they floated past her. What she noticed instead was the absence of footsteps, the absence of voices, the absence of anyone who knew she was home. Her daughter lived 3 states away. Her neighbor, Mr. Jenkins, had offered to bring in the mail, but he worked nights. The home health nurse was scheduled for tomorrow morning. Tonight it was just her. The loneliness arrived not as sadness, but as disorientation, a sudden awareness that she was the only witness to her own recovery. She tried turning on the television, but the noise felt artificial. She packed up her knitting. She picked up her knitting, but her hands trembled. She reached out for her phone, then set it down again. She didn't want to bother anyone. By 8 p.m., the house felt colder. She reheated soup, but ate only a few spoonfuls. She shuffled to the bedroom, each step reminding her of the fracture, the weakness, the new fragility she didn't want to name. She sat on the edge of the bed and stared at the empty space beside her. In the hospital, she had been a patient. Here she was something harder to define, a woman trying to heal in a place that no longer felt like home. When the phone rang, she startled. It was the transitions nurse from the hospital calling for a routine check-in. How are you settling in? The nurse asks. Miss Alvarez opened her mouth to say, fine, the reflective answer. But something in the nurse's voice, steady, unhurried, made her pause. I don't know, she said, finally. It's just quiet. The nurse didn't rush. She asked a few gentle questions about meals, about mobility, about who could stop by tomorrow. She listened. She made a plan. She told Mrs. Alvarez she would call again in the morning. When the call ended, the house was still quiet, but the silence felt different now. Less, less like abandonment, more like a pause between moments of connection. Miss Alvarez lay back against the pillows. She was still alone, but she was no longer unseen. Why this vigilette matters for policy and practice. Each each bullet begins with a guided link to you can explore, or no, each bullet begins with guided a guided link so you can explore the implications further. Loneliness as a clinical destabilizer. The vigilette shows how isolation amplifies fall risks, medication non adherence, and functional decline, transition transitions as high risk moments. The first the first 48 hours home are the most dangerous for socially isolated older adults. Value of proactive outreach. A single check-in can interrupt the spiral of disorientation and fear. Need for structured connection plans. The nurse's illustration the nurse call illustrates how screening must trigger action, not documentation. Integration with HCBS and community partners. The Vigilettes hints at the gaps that community based support could fill. All right, guys, that is your B for now. I will be back on with C shortly. Give me a bit for a break, and I will be back with you shortly. For now, Gator Wellness, take care, folks.